I would like to ask Dr. Sankaran to introduce our first speaker today, Dr. Farokh Master.
Yeah, so good morning, everybody. And you can say also, so before I say something about Dr. Farokh Master, so I would like to kind of set the background, See, what is homeopathy? Let's start with this. And what I found was that it's very, very multifaceted. And there are many ways to approach it. It's quite fascinating. How many ways you can look at it, practice it, and everybody has success. It's not that one is right and one is wrong. I want to give an example, we have Annette here with us, who is a partner of my very, very dear friend who's not with us, Jürgen Becker. I don't know you know him or not. Jürgen Becker from Freiburg. You know him? Once I was at his clinic, he fascinating person, you see. He was dealing with dreams and mythology and the gestalt of remedies and provings and an unbelievable dimension, which was fascinating to me, you see. Never seen homeopathy in that. The first time I met him, he took me to the Black Forest, straight from the train station. And he sat me down, it was evening hours, and he started telling me fairy tales and connected them with homeopathy. It's a way of looking, no? And things seem to happen to him also, because when I was sitting in his clinic, a patient came, he said, this is a very difficult patient, Rajan. He's been coming to me for years and years. I can't find his remedy. I hope today something will happen. So the patient said, well, doctor, I had a dream 2 nights ago. In this dream, somehow the alphabets came one after the other. First came L, and then came Y, and then came C. He said, does this have any meaning for you? So Yogan, with a very straight face, he asked, did you see any numbers at the end of it? So there is a dimension of homeopathy, which is like, so in some sense, what can you call it, And what Anne showed us, going into the depth of something, and what Dinesh showed us, or what Mikhail showed us, understanding the very essence, the chi, Anne would call it the chi of the remedy, the spirit, the essence. And then kind of classifying them into the different kingdoms, into the different columns. And now I have found another way of classifying them into super classes, which really helps me a lot. So this is one way of homeopathy also. Now we come to Dr. Farokh Master. So, you see, I'll tell you another story. I was in Switzerland about 10 days ago, I met Heiner Fry. You know Heiner Fry, yes? So he does polarity analysis. So he takes the modalities, puts them into a software, and the positive and the negative, and then there is a remedy at the end of it. So I talked to him and I said, how did you come to this? You know? And he said, I have a very, very busy pediatric practice. I see 40 patients in a day. In Switzerland, that's a big number. It's relative, isn't it? Farokh Master just sees 250 patients a day. That's normal. So he says, I see 40 patients a day. And how do I do, classical homeopathy? Difficult. So I found this way. So each one finds a way out of the necessity of his situation. So in India, homeopathy is recognized by the government as a system of medicine. And we are allowed to treat every possible condition from cold to cancer. We have equal rights and privileges as a modern medical doctor. And we undergo a course which includes medical subjects, anatomy, physiology, and medicine, and like that. Dr. Farokh Master was 1 year senior to me. We were in the same college together. And then we worked in the same hospital. So we stayed in the same room for a few months, seeing patients together and having a lot of fun. He's an amazing fun guy, I must say. Amazing fun guy. If I were to tell some incidents, he said, let's go to the movie. We were together. Let's go to the movie. I said, no, and he always wanted to watch the first show of the movie, the premiere. And they were always full. So he took me, I said, we can't get the ticket. No, don't worry, come with me. So he went to the manager of the theater. We are doctors. We work night and day, looking after suffering people. And this is the hardly 3 hours we get for ourselves. We got the tickets. So he has a very persuasive, and this persuasive kind of personality got him into the major allopathic hospitals in Mumbai as a homeopath. He set up homeopathic departments. And how did he do that? Because his knowledge of medicine is excellent. I have seen him study night and day in the college library and, brush up his knowledge of medicine. So when he spoke to the modern medical doctors, he spoke their language. Sometimes even better than them, he was very good at it. And then he showed results with homeopathy. So as a result of that, he got patients who were really critically sick. I mean, we are talking of end-stage renal disease, multiple metastases in cancers, strokes, coma. These are the kind of cases he treats. You see? Now, can you imagine him doing an Anne Chardet type of case taking in a comatose patient, What do you feel? What do you experience? What is your, there is no time for that. It's a different situation. So he has to have a different strategy. And that is the strategy that he has evolved. It is a more therapeutic approach. So the individualization becomes somewhat less. And the name of the disease and the pathology becomes more prominent. Of course, there is still individualization. That is the crux of homeopathy. But he deals with a completely different class of patients than many of us, you see. And he goes right into the hospital and treats them. And then he has to show the results because otherwise our reputation goes down. So I really, if I had a hat, I would take it off. So hats off to this amazing worker. And he's no words to describe what he's doing, what he has done, and we'll really learn a lot from it. But the whole idea now I want to share with you is with all these methods, we can get confused because we don't know which is good for what, you see. So we'll see impressive cases from it. Oh shit, I should be doing that, not this, you know. And then you see Anne's cases. No, I should be doing that, not this. Does this happen or not? So we have to find a way to integrate all of these approaches and give place for every approach in a much larger context. That's our challenge also. So, yeah.
First of all, big thank you for inviting me to this wonderful conference. It's my salutations for conducting this kind of conference for last 30 years is something very creditable. Basically, my background was that I was in a medical school and I shifted from medical school to homeopathy. So my birth into homeopathy was not by normal delivery. It was a breech presentation. And it was always my dream to integrate homeopathy into mainstream medicine. So most of my life, I have worked in hospital as a general department of homeopathy. In the last 5 years, I have also started palliative oncology care with homeopathy in King Edward Memorial Hospital, Bombay. Now, the type of cases as Rajan has described, I don't see cases like cough and cold and allergy and itching and hair falling and acne and painful menses. Very rarely I see such cases. The type of cases that I usually see are advanced pathology, death or near death, or cases which are very, very badly suppressed with allopathic drugs and they come to us for homeopathic treatment. According to me, I feel homeopathy is like a huge garden and every homeopath is a gardener. And he grows flowers in his own way. Some will grow roses, some will grow lilies, some will grow sunflower, but we all grow flowers. As Rajan said, we all get results. And that's really very good. That's really very good. The problem is that in an institution where I work, our work is constantly monitored because we are only kept on 12-month contract. And this I have been doing for last 35 years. So every month, every year we have to renew the contract. And for renewal of contract, they assess your results, what you are really doing with homeopathy. Does homeopathy work? Are you showing results? And all those things. So we are working on a tight rope, you know, that we should show some results. We see a lot of autoimmune cases, and that's why I agreed when I received an invitation that if I can share my experience. Now here, all the autoimmune cases that we see are drugged and drugged for many years together. And then they come to us and say, now we want to start homeopathy and stop those drugs. It's not very easy. Okay. So we have got good success. And one such case I am going to show you in the first hour. And in the next hour, I'm going to show you the strategies which I apply in treating such cases. So this will be my today's presentation. This is the first case of a severe acute exacerbation of 50